I am not an expert in either trade agreements nor intellectual property, but I do have some expertise after 30 years of responding to epidemic disease and pandemics as an infectious disease clinician. And I'd just like to mention that, we have obviously very deep experience of vaccine apartheid, but also, as Karen said, diagnostic and therapeutic apartheid, or suggested. We need to focus on all of the tools that we need to respond. Um, I just want to look for a couple of optimistic points. One of them is to look back at recent history, as we've been called to do. When HIV, when I started medical school back in the 80s, HIV was rapidly becoming the #1 killer of adults, men and women in the United States and in Haiti. And I spent and still spend my time between these two places, between Harvard and Haiti. And on the one hand, at Harvard, when we discovered, as I was just finishing my training, that a 3-drug regimen or a multi-drug regimen of antiretrovirals would suppress HIV, we were begging our patients in the Harvard teaching hospitals to take these medications. Meanwhile, in Haiti, our patients were begging us for access to them. This is another form, again, of therapeutic apartheid, right? If you experience it as an individual clinician, it's very painful to go from Harvard to Haiti and ask yourself, what do we say to our patients there? People like Tony Fauci broke this impasse by focusing on therapeutic equity and bringing it transnationally. And a number of initiatives that have emerged in the last 20 years, including the President's Emergency Plan for AIDS Relief, have really shown us how to engage with the problem or the challenge of intellectual property in a meaningful way and bring millions of people on board into medical modernity. That is exactly the situation we face right now. The difference being we cannot afford, as Jan said, we cannot afford that delay between the development of new technologies and their widespread and equitable distribution. So the challenge that we now face is to learn the lessons from previous efforts to promote global solidarity around health and social justice, and to speed up the process by which we can distribute these drugs. As has been clear, and as many organizations signing on to this letter have pointed, the TRIPS waiver is critical to this. We still have Tony Fauci on our side, who has argued about the moral responsibility we have to make sure that intellectual patents don't prevent the rapid rollout, not only of vaccines, but of diagnostics and therapeutics. And I would mention that in briefings, including ones that Congresswoman Schakowsky has organized, queries of the major pharma companies about waivers like this, only Moderna said they were not hostile to the or opposed the idea of the waiver. And I think we need to continue our engagement and think a lot about the map of opposition to this waiver. If you look at the map of opposition, it's largely a north-south divide again. It's also a post-colonial divide with the North, Europe, United States, alas, among them, being opposed to the South. All 55 member states of the African Union have signed on to a waiver like this. And we need to stand, as you said, Lori, on the right side of history. Finally, I would just add that if you look at a country like Rwanda, it is clear to me after many, many years of experience there, and luckily Congresswoman Schakowsky and others on this call have also had the chance to spend time there. It's clear to me that they can do both a vaccine rollout, respond to epidemics, and consider manufacturing of the diagnostics, therapeutics, and preventives that we need. I hope we will all come together and end up on the right side of history. Thank you very much. I yield.